Hi everyone, it's Mrs. Janke. Thanks for checking out my video on our textbooks, Today's Medical Assistant, which we will be using for medical office management as well for many of our other courses in the medical assisting program. So first off, we have Today's Medical Assistant. This is our major textbook. It is the 4th edition and it's published by Elsevier. And this particular text is written by Kathy Bonwit West and Sue A. Hunt. So you want to have one of these textbooks. It is a newer edition. It was only published in 2021. You might be able to find a used textbook out there, which is totally fine. There are also ebooks out there, so many students opt to use an ebook, which is fine also. Ebooks, however, they're typically rented for the semester, but you will need these textbooks for the full year. So if you are going to rent, make sure you rent for the full year. Sometimes you get a better discount or a better price on that rental, knowing that you are going to use it for both semesters. On the inside cover of this textbook, there is a little scratch off area that you can reveal a code. It's not necessary to have that code. If you do get a used textbook, that code might already be scratched off. If it is, you won't be able to use it again. It's a one-time only code. That code, however, will give you some additional access to different aspects of the textbook, different ways to study, flashcards, practice test questions, those types of things. So it's kind of a nice additional thing to have if you do end up getting a new textbook, or if you get the ebook, you should be able to get that code with it. All right. These textbooks are grouped by chapter, and we will go through the textbook by chapter. Starting off in medical office management, we do start off with chapter 1, the healthcare system. All right. So at the beginning of the chapters, they always list out the learning objectives, what you plan to learn in this particular chapter, the outline for the course, as well as different key terms. Now, the key terms are incredibly important. I do recommend for students to make flashcards, if it's only for the words that they don't understand, to keep practicing those terms, because those key terms are the kinds of things will be coming up again and again. Especially when you go out in your clinical, it's good to know all that terminology ahead of time, because it really is handy, and it gives you a better sense of what you're doing and where you need to go. All right, so key terms are really important to focus on. Next, we have our study guide. Another huge book, and it looks just like our textbook. This one is also the 4th edition, also written and published by the same publisher, Elsevier. And this study guide, I highly recommend you get a brand new copy. This study guide is going to be filled with your own work. Homework assignments are given in this study guide, not only for my class, but for all of my courses as well as some of the other courses. So it's easier to have all your information in your study guide as opposed to writing everything down in a notebook or typing everything out on a tablet or a computer. You certainly can do that. I'm not saying you can't. It's just I find that this was a great reference tool for me to go back to help study for exams, help study for midterms and finals, as well as the national exam. So this was a great reference tool for me to even go back to when I was out on my clinical, and if I wasn't sure about a certain procedure or what was going on, I went back to this book and read through the different information that we had covered in the course. So it is incredibly helpful. All right. Again, this is also grouped according to chapter. So these chapters typically start off with a pre-test and a post-test. These are excellent. They're just true-false questions, but it really gives you a good sense of how well you understand the information that you've read in the chapter. Everything that you read in your chapters will go in order with how the questions are listed in your study guide. So a lot of people do like to read the chapter, read a paragraph, and then answer a question. Read a paragraph, answer the questions. The first half the pre-test and post-test. And there's another section of key terms, which is just a matching section. Those particular sections don't line up exactly with the textbook, but all of the other questions do. The evaluation of learning exercises, all of those questions are in line with how that information is listed in the chapter. So sometimes you'll go through the chapter, you'll be answering questions, you get to question 4, and you cannot find the answer. Move on, look at question 5, and if you find the answer for question 5, chances are the answer for question 4 will be in the paragraph above where you found the information for question 5. So that's just a little hint when you're going through the chapters where to find the information. Sometimes it is a little bit challenging. So just know that it does follow how the chapter is typed out. Additionally to all of this information in your study guide, the end of the chapter in the study guide will give you our competencies. Competencies are the hands-on skills that you'll be learning in the course. I'm just trying to find one for medical office management. Here we go. All right. So, evaluation of the competency. This particular one is locating and defining the state's legal scope of practice. So that's the name of the competency. These competency sheets will go step by step exactly what the student needs to cover when they're performing the competency from me. So for medical office management, most of the competencies that we complete will require a paper or an electronic submission of information. So for this particular one, for figuring out the state's legal scope of practice, I show you which website to go to, and you type out a small paragraph about where to find it and what information you found. And then that information you can email to me, send off in Canvas. There are a lot of different ways that you'll be able to submit that material. I do check assignments and make sure that each and every one of these points are listed in the assignment that you completed. For accreditation purposes, all students must pass competencies at 100%, okay? So if you hand me in something that is missing information, I will point out that information and ask you to resubmit with that new information listed. Your grade then for that particular competency is going to be an average of those 2 attempts. So if you handed in your assignment to me and something was missing, I only gave you a 90 out of 100, and I asked you to resubmit, now it's going to be 100 out of 100. Your grade will actually be a 95 because it'll be an average of 90 and 100. You do need to accomplish the competencies in 2 tries. So we don't try and sign anyone off until they're ready to. However, in medical office management, since most of the assignments are written assignments, it's pretty easy to go back and check your work. All of these assignments do get graded right away. And if any resubmissions are required, I will send you that information via an email, or I'll track you down here in the classrooms and let you know. Okay. Each one of these competencies, each little task has a different symbol associated with that step, and each one of those symbols is a different amount of points. So every single competency, and the competencies are listed in your syllabus, have a different number of points, okay? So if it's 94 points, you're looking to get 94 out of 94. If it's 68 points, you want 68 out of 68. If it's 274 points, you want 274 out of 274. All right, so that's kind of how it works with competencies. So again, all of this information is in the study guide. And there's an additional way to help you prepare for all of these competencies. In medical office management, again, since it is mainly a typewritten assignment, it's not as difficult, but for medical assisting techniques for that particular course. That's really more hands-on when we're doing vital signs and other information like that. There are these blue boxes. It's a very pale blue. But in your textbook within the chapter, all of the procedures or the competencies are listed. All right, and this will give you the exact step-by-step of what you're looking for, of what you're going to be doing for that particular competency. Sometimes information in your homework assignments, if you cannot find the information anywhere, read these competency text boxes. There's a lot of great information in here, and it does talk about sequencing, what steps come in order, and there is sometimes information in these text boxes that relate back to the homework. So when in doubt, if you can't find the answers in your homework assignment, check these blue boxes because I can guarantee you there'll be information in there. I hope that was helpful. I hope you find these textbooks helpful. I think they're pretty great. There are always a few errors in them, but that's to be expected. And if you have any questions, please let me know and we'll go through it in the class again as a group. But I just wanted to give you a heads up about what to expect in the textbooks. Thanks so much. We'll see you soon.